Hello everybody and welcome to the Thursday edition of Video Clips. One of the most commonly used drugs in the United States is proton pump inhibitors, or PPIs, which are taken to treat heartburn, reflux, and indigestion. These include drugs that you've heard of like Nexium, Prilosec, Prevacid. They're advertised a lot on television. Sales in the United States are currently over $13 billion per year. Proton pump inhibitors, or PPIs, reduce the production of acid by the parietal cells in the stomach by blocking an enzyme that leads to its production. The drugs are considered safe and effective and are available over the counter, but there are some serious side effects which I'm going to discuss in today's video clip. A major problem with PPIs is that they're not being prescribed in accordance with the terms under which they were approved. The FDA approved the drugs for short-term use, basically a few weeks. If you go back and read the initial approval, instead they're being taken for months and years, and in some instances decades. And because they're available without prescription, most people who take them are not being monitored by a health professional. I don't have a lot of confidence that health professionals would be anxious to take people off of these drugs, but the side effects might be more noticeable if somebody was watching for it. Additionally, PPIs are often prescribed for conditions for which they have not been proven to be effective, such as for the prevention of stress ulcers. It's estimated that between 1/3 and 1/2 of all patients taking PPIs have conditions for which the drugs are not effective. One study concluded that PPIs are frequently prescribed prior to any diagnostic testing, commonly given to patients who don't meet the criteria for taking them, and often when less powerful drugs would have been as effective or more appropriate. The researchers expressed concern about safety mainly because the potential to delay the diagnosis of cancer can be high when the drugs are prescribed based on symptoms alone without any type of diagnostic testing. Inappropriate prescribing, however, is only a very tiny part of the problem. PPIs have serious side effects. Several case reports, a review of biopsy reports, and many studies have shown an association between taking PPIs and acute kidney injury, acute interstitial nephritis, and development and progression of chronic kidney disease. Not all studies have shown a statistically significant relationship, but most do, including a large prospective cohort study including over 10,000 patients. One research group concluded that while studies showing the connection were observational, and we do need to take that into consideration, the fact that the relationship has been shown in so many analyses, and there are biologically plausible mechanisms of action which include higher risk of hypomagnesemia, makes it highly likely that the association is real. So the take-home point is that taking PPIs can lead to chronic kidney disease. A concerning public health issue is the increase in community-acquired C. diff infection, and PPIs are a known cause. Gastric acid is an important part of the body's defense against bacterial infection, which is why taking the drugs increases the risk of C. diff and other pathogenic bacterial infections. Studies show that higher levels of gastric acid are needed in order to kill C. diff and other pathogens, so obviously suppressing acid production is a bad idea. The effect of the drugs, the PPIs, is dose-dependent. One study showed that taking them daily increased the risk of developing C. diff infection by 74%, and more frequent use increased the risk by 136%. Taking antibiotics while taking PPIs, which happens quite commonly, increases the risk even more. Other side effects include increased risk of community-acquired pneumonia, dementia, and B12 deficiencies. PPIs increase the risk of hip and some spine fractures, and the effect appears to be dose-dependent, with both higher doses and taking the drugs longer significantly increasing the risk. The drugs are frequently prescribed to patients who have had a heart attack, and those taking them had a 30% increased risk of adverse cardiovascular events after discharge from the hospital. The gut microbiome has been shown to influence almost every aspect of health, ranging from gastrointestinal disorders to mood. An increasing number of studies are showing that taking PPIs results in negative changes in the gut microbiome that increase the risk of infection. Changes in the microbiome due to PPIs may be one of the reasons why GI symptoms such as diarrhea, constipation, nausea, stomach pain, gas, and vomiting are all listed as common side effects for all of these drugs. One of the problems with PPIs is that they're very difficult to discontinue, and this is where things get really interesting. Research shows that when people stop taking them, there's a rebound effect that involves even higher secretion of acid than before the drug treatment was initiated. One study concluded, quote, The current finding that these drugs induce symptoms means that such liberal misprescribing is likely to be creating the disease the drugs are designed to treat and causing patients with no previous need for such therapy to require intermittent and long-term treatment. Another research group reported that discontinuing PPIs following 3 months of therapy resulted in gastric and secretory capacity increasing by 20% over pre-treatment baseline. Now, this is after only 3 months. Now remember, I said people take these for months and decades. You probably know people who've taken them for decades at a time. Yet another group reported that this increased production persisted for 2 months after discontinuing the drugs. In fact, increased acid production following discontinuation of PPIs takes place even when people who don't have reflux take the drugs. In one study, 120 people who didn't have reflux were randomized to take a placebo for 12 weeks or a PPI for 12 weeks, followed by 4 weeks of placebo, the ones that were randomized to take the drug. During the period after the drug was discontinued, 3 times as many patients in the intervention group had acid-related symptoms as those who took placebo, and 5 times as many had to take a medication to treat their symptoms. Now, one of the problems, as I mentioned earlier, is that a lot of people are taking these drugs who do not have acid reflux. They may have something else going on. But the problem is that taking the drugs may induce a disease they didn't have and were hoping to address. When they later find out through listening to somebody like me or reading something online or however they find out that the drugs aren't a good idea, they may find that they've developed a whole problem in response to taking the drug that was not the original disease or condition that they had. PPIs do reduce acid, but in spite of this, they often don't reduce symptoms. And one of the reasons is that they can't strengthen the lower esophageal sphincter, and they also can't address some of the other contributors to reflux that don't go away when you reduce acid production. One of them is being overweight. Losing weight is an important strategy for reducing reflux since excess weight places a lot of pressure on that lower esophageal sphincter and weakens it. In one study, 88% of obese patients who lost weight were able to stop taking PPIs or take them less frequently within only 1 month of the weight loss and after losing only 17.5 pounds. So think what would happen if they adopted a great diet and lost all the excess weight. Dehydration is a contributing cause to many health conditions, including reflux. And I was able to find some studies that showed that just increasing water intake was shown to increase gastric pH faster than PPIs. So your problem may be that you're dehydrated, not necessarily that you are producing too much acid. Constipation is a cause of reflux, and this is usually pretty easily removed or addressed by eating a high-fiber, plant-based diet and avoiding dairy products. In fact, one of the common things we hear in this office after people adopt the diet that we teach is that it's quite the moving experience, so that might be part of your problem too. Eating a higher fat diet contributes to reflux, and symptoms of reflux are worse for 3 hours after eating a high-fat meal. Diet is a known cause of damage to the gut microbiome, which in turn is a cause of reflux, so taking PPIs adds to the damage, which means that taking a probiotic is probably a very good strategy for anybody who has reflux, even if you haven't taken PPIs, but especially if you have. In summary, reflux is preventable. Eating a high-fiber, low-fat, plant-based diet, drinking enough water every day, and maintaining normal weight is the best option for prevention. The dismal performance of commonly prescribed drugs like PPIs, along with their serious side effects and rebound effect if you try to discontinue them, makes diet and lifestyle change a much better prescription for addressing reflux if you have it. All right, that's all for today, and actually all for the week, so please feel free to pass this on to anybody who you think might enjoy it. I'll be back to you next week with more news.